we're down to our last testifier. We've got Dr. Clifton Otto that contacted me, and so I think he's queued up on Zoom. So Dr. Otto, can you hear us?
Yes, I can. Can you hear me?
Yes, thank you for joining us. You saw the briefing notice, reached out. We're glad to have you here as a physician. Please do share your thoughts on access to safe alternatives to opioids.
Well, thank you. Good afternoon, chairs, vice chairs, members of the committees who may be watching remotely, and distinguished guests. Thank you for the opportunity to talk with you about fighting the opioid epidemic. My name is Dr. Clifton Otto. I'm a medical doctor in Hawaii, cannabinoid medicine specialist, and a certifying provider for Hawaii's medical cannabis program. My disclosures are that I have no association or commercial interests in any dispensary, patient co-op, or hemp company. I'll keep my comments very brief and focused on cannabis as a potential treatment for opioid use disorder. If I were a psychiatrist, I could hold up articles showing you that cannabis could lead to a higher risk of opioid abuse. And if I were a harm reduction specialist, I could show you articles on how cannabis is reducing opioid prescriptions and opioid-related deaths in states with medical and adult use cannabis programs. My point is that to consider cannabis as a possible treatment for opioid use disorder, we really need to be looking to healthcare providers with boots on the ground in Hawaii. I can tell you that I have registered patients who qualify under the severe pain category who are successfully using cannabis to maintain their take-home supply of methadone with their counselor's approval. I also have patients who become addicted to opioids after surgery who are able to completely wean themselves off of prescription painkillers using cannabis. And I have a local methadone clinic calling me, wanting to refer patients because nothing else is working. You could also talk with other certifying providers in Hawaii, like Dr. Thomas Cook, who wrote the letter of support for the opioid use disorder petition that was denied by the Department of Health in 2019, and you will hear similar stories. The question is, how can we move forward with local research on this topic? The Office of Medical Cannabis Control and Regulation has a dedicated epidemiologist who could certainly help us look for signals by surveying registered patients who are already using cannabis to reduce opioid use, and they may have access to funding. We also have a University of Hawaii cannabis research program authorized under Chapter 304A of Hawaii Revised Statutes that could be utilized by the medical school to conduct an observational study on opioid use reduction in registered patients. And there is also the option of adding opioid use disorder as a qualifying condition to the Hawaii's medical cannabis program, either by repetitioning the department or by statutory amendment. I would only caution that in our efforts to fight the opioid epidemic using healthier alternatives such as cannabis, we should not end up substituting dangers of opioid addiction and interacting with the illicit opioid market with the devastating consequences that come along with patients having to violate federal law to participate in our state medical cannabis program. We need the governor to act on the federal situation with cannabis in Hawaii beyond simply waiting for Congress to remove cannabis from the Federal Controlled Substances Act. Those are my comments, and I welcome any questions. Thank you.
Thank you, Dr. Otto. Chairs, any questions?
I have one question.
Yes, Chair Belatti.
Dr. Otto, thank you so much, and I know you've been a long time advocate in this space. Do you know if any medical cannabis program in the States has been able to add opioid use disorder as one of the qualifying conditions?
You know, actually, I would have to look into that. I don't follow the other state programs as closely as I do ours, of course. I would have to look into that, and I could get back to you on that.
And I know, just because you're so well read and well researched, do you know if there's any international studies or any medical studies that are looking at this specific issue of cannabis as an opioid use disorder alternative?
Well, there are several articles in the literature already that have documented that, and I'd be happy to send you links to those. So I think it's been well established that cannabis could possibly be a way for patients to get off of opioids and avoid opioid addiction. So I believe the next step is to put something together, do some type of research so that we could know what actually is going on in Hawaii and what the potential is for using cannabis to address the opioid epidemic.
Thank you, Doctor. Thank you, Chair.
Thank you. Dr. Otto, we've got another question from Chair San Buenaventura.
Hello, Dr. Otto. So isn't relief from pain already one of the conditions that cannabis can be prescribed for?
Well, yes, exactly. And
Yeah, okay.
that was one of the reasons that was stated in the denial of the opioid use disorder petition in 2019. They said that patients have access under the severe pain category, but also under the severe nausea category, which patients experiencing when they're coming off of opioids. So that's why I was mentioning in my comments that there's probably already a lot of data available that we could research from registered patients to see how they're using cannabis and how they've been able to get themselves off of opioids.
Okay,
So,
it's just a
you know,
question.
if you're,
Sorry.
sorry.
So because it's already covered, it's just a question of educating the PCPs instead of cutting off patients, to be able to educate them on who to refer these patients to.
Well, I would
that's
say
what it
yes,
sounds
education is definitely part of the puzzle, but I think we need to do some research on this. There's a lot of data that we need to look at to see what the prevalence of its use is in patients who are using this to treat their opioid use disorder already. I think that could be helpful to inform how the state wants to potentially use cannabis for this.
Okay, thank you, Dr. Otto.
Dr. Otto, when you email Chair Bellotti, could you also CC Chair San Buenaventura and myself?
Absolutely, I'd be happy to.
Thank you very much, Dr. Otto. Appreciate you. Before we
Thank you.
close, thanks, Doctor. Before we close.